Cohen Roth, founder and CEO of Cannabis MD. Welcome to another Cannabis MD video profile. I am excited to be joined on this one with Dr. Paloma Lehfeldt. I'll be introducing her in a bit. As you know, if you've been watching these and following us, thank you for that. But I am having these great conversations with leaders in the medical cannabis industry. These are physicians like Dr. Lehfeldt. These are owner-operators, scientists, researchers, regulators, and policy influencers. These are folks who are certainly impacting the cannabis industry of today and certainly the medical cannabis industry of the future. So Dr. Lehfeldt, she will be joining us on October 3rd as a member of the regulatory panel for the Cannabis MD Cannabis Science and Therapeutics Provider Education Forum. Dr. Lehfeldt is a lifelong cannabis student and advocate who serves as the Director of Medical Education for Vireo Health. She brings to Virio more than 10 years of experience in psychiatric research, community outreach, and teaching. She has expertise in neuroscience with a keen interest in mental health and the endocannabinoid system. Her interest in cannabis as medicine is a direct result of working with patients and research participants unable to control chronic pain and their subsequent opioid dependence. She, undergraduate Drew University, double major psychology and music. She's also a rock star. We'll talk about that towards the end. She has a Master's of Arts at NYU in biologic psychology, and she received her medical degree from Ross University School of Medicine. At Vireo Health, Dr. Lehfeldt is the direct line of communication between providers, physicians, and organizes outreach events, conferences, continuing education, and lectures for both providers and patients. Vireo Health itself is a physician-founded, patient-focused company, a cannabis company dedicated to providing best-in-class cannabis-based products and unrivaled care. Vireo is best-in-class medical, scientific, and engineering practices, or they integrate these best-in-class practices in the medical, scientific, and engineering practices into the cannabis industry. Spit that one out. They're committed to creating safe, all-natural cannabis products with compassionate patient experience. Thank you to Dr. Paloma and your Virio colleagues for being a supporter of our provider forum, and your support enables 10 clinical students across the country, whether they are medical, nursing, pharmacy, and or mental health students, to be able to attend our virtual conference. So thank you for the support there. And again, that underscores Virio's focus and mission. As well as Virio's been a supporter of Tpad, the social, a sister company of Cannabis MD, a social enterprise that I launched in February of 2019, whose mission is to break down barriers to entry into the cannabis industry and to empower access, no matter gender or race, via education. So thank you for the shared commitment. We're also going to be speaking towards the end of our conversation about your leadership in ensuring diversity and what Virio has just started. So let's get into our conversation. So how did you get specifically into the cannabis industry?
So, well, first of all, thank you so much for that introduction. And Virio and myself personally, we're huge fans of the work that you're doing across the country.
Appreciate that.
For real. Medical education, diversity, it's in our DNA. I know it's in yours, so it's always a pleasure to work with you.
Yeah.
So cannabis, I mean, it was a dirty word growing up, but someone that has always been obsessed with neuroscience. I really consider myself a lifetime student of cannabis. In undergrad, I wrote my honors thesis on delta-9 tetrahydrocannabinol, and
wow. When was this?
Right? This was a long time ago. I'm not not that long, but yeah. So yeah. It was something that I've always been so interested in, both on a biochemical level, but also a psychological level. And I've really continued pursuing knowledge about it throughout my academic career. You just listed off my academic accolades, but throughout all of those, I never was taught about cannabis except for its potential for abuse. So this is something that I've always kind of pursued on my own. And when I met Virio and the Vireo team, it was just perfect because finally these were colleagues and other physicians that also were passionate about cannabis and its therapeutic effects. So I brought all of that independent knowledge I had to this team that had such an amazing research portfolio and academic background. So it was just a very happy marriage.
Yeah, and we're talking about Dr. Kingsley and Dr. Dahmer, the founders, co-founders of Virio.
Yes. So Dr. Kingsley is a board certified ER physician, and he fell into cannabis from seeing a firsthand Vietnam veterans that were self-medicating with cannabis before it was really a medical market, and just showing firsthand, as many physicians see, that they are decreasing their opiates on their own with this plant. So really amazing. And that's not a rare story. A lot of times physicians just see one patient that are literally throwing away their heavily addicting and potentially lethal medications for this much safer alternative. Really amazing to see.
It truly is. And we can go down that rabbit hole, which tremendous. The diseases and disorders that cannabis definitely is efficacious for. So as a physician, you are uniquely qualified to lead Virio's physician education initiatives and healthcare provider education initiatives. What are the most important messages to these professionals?
Sure, that's such a great question. I wish I could have 2 days with every physician, but sometimes we only have 5 minutes. And it's important to, within those 5 minutes, really communicate why this is so important. This isn't just a phase that people are partaking in. This is a plant that we've co-evolved with for thousands and thousands of years.
Right.
So the first thing I always say is, can you imagine if you went to medical school and you weren't taught about the cardiovascular system?
I reference this quote regularly.
Yeah, because and you take a step back, because it's shocking when you hear about the endocannabinoid system, the therapeutic benefits, everything at once. I always compare it to drinking, water out of a fire hose at the beginning, because there's just so much out there. And it really is equatable to not learning about, one of our important organ systems, like the cardiovascular system, in that the endocannabinoid system is interacting with everything. It interacts with your nervous system, your immune system, everything. So it's the exact same thing as just, I'm not going to go to med school for 3 months and just sit out this part of the curriculum. And it really is like that. So that's always the first thing I do say. And then the second is to really involve the healthcare practitioner with the research that's out there. This cannabis has been researched so much, but it's been by NIDA and by a lot of the side effects of the plant. And that's what is brought to the table as a medical professional. That's what we learn about. We learn about cannabis as a drug of abuse, not as a therapeutic, rock star that it is today. So really just having that juxtaposition of what it is and what it isn't that we've been taught about. It's really hard to change we all know, we're taught all of these things, they're ingrained in us. And so to go back and say, actually, this is what is actually the truth. Let's take some time to kind of talk about it and also learn about why we weren't taught about it. So talk about the scheduling of cannabis and the racial stigma associated with cannabis as well is something that I always take to fellow physicians and healthcare providers.
Are they receptive? Are physicians receptive when you have conversations? I mean, their patients are asking for it. I've talked ad infinitum just about, that there's the mismatch of the education. I mean, what you were saying, it's, cannabis use disorder versus the benefits of an adjunctive or standalone therapy in some cases. So are the physicians that you're talking to, are they receptive?
That's a great question. And I think absolutely now, because they're tired of seeing their patients dying or addicted to these pharmaceuticals. And again, I always say, cannabis is not a panacea. It's not going to replace everybody's opiates, you know, and there are certain populations that absolutely require opiates in their treatment regime.
Mm-hmm.
However, when you come in and you say, you know, I have something that can help your patient, that can work as an adjunct therapy. And here are these, you know, 20 peer-reviewed articles on chronic pain that show that cannabis decreases pain in our elderly population, who is our fastest growing demographic in the United States.
Right.
You know, the problem with not only opiates, which are just the tip of the iceberg, are our NSAIDs, which are completely toxic to the kidneys, which are completely toxic to the heart, which are less able to kind of deal with these really harsh pharmaceuticals as we age. And because, you know, our elderly population is increasing, we're in such need of an adjunct therapy or replacement, because we haven't had one since the 1970s, a new pain medication. I say that over and over again till I'm blue in the face, because that really helps us realize, okay, you know, I'm a doctor in 1850. I have cannabis in my medicine bag. I'm using nature to treat these patients with pain. And then to take that away because of racial stigma as the only reason, it's just, it's inane and it makes no sense. And when you take time to kind of go through the history as well as the physiology, hand in hand, physicians are so receptive to it.
That's good to hear. Yeah, and we were talking about, before we get into, wanted to certainly hit the research, and you again are on the regulatory panel, as you know, and so the challenges to clinical practice as well as to research because of the current status as a Schedule I. But prior to that, so case in point about the research papers and a bit about the difficulties, but as you know, so I'm in the University of Maryland School of Pharmacy, Master's of Medical Cannabis, and you had lectured one time at our introductory seminar. You're going to be presenting again at an upcoming seminar and get in as a lecture. And so with your particular focus and area of passion, sounds like with mental health, we just talked about, I had you review a question for me in my homework, and that there were it was conflicting. And we were talking about these conflicting studies. So how should providers manage this? What's the best?
So providers, so we're taught from very early on to practice evidence-based medicine.
Yeah.
And what that is having research to back up any decision that you make. And that's one of the issues with cannabis. We just don't have that because there's no available, legally, you cannot perform RCTs, which is randomized clinical trials. And the reason, randomized controlled trials, the reason that you cannot do this is because cannabis is listed on the Controlled Substance Act, which was enacted over half a century ago as a Schedule I drug, making it, you know, federally inaccessible to perform research.
And has no medical benefit.
No medical benefit, and it has no place in medicine whatsoever, and a high potential for. This is in the same category as LSD and peyote, and then we have our on Schedule II, which is controlled by the pharmaceutical industry. We have codeine, we have cocaine, we have these lethal drugs, you know, and many of these have gone through clinical trials with the FDA and have been passed. So what is happening now is a lot of legislators are trying to reschedule cannabis instead of deschedule, which is what I'm passionate about. We want to deschedule. We want to make it available for everyone. If we reschedule, not only is it going to, it'll open doors to research a little bit, but we have to remember that the FDA path is a multi-billion-dollar path, and in 10 years, which we very frankly just don't have time for. This should have been done years ago. So by rescheduling, it opens the door to FDA regulation, DEA regulation, and then we're going to be treating a botanical plant with over 1,000 different molecules in it in the same way that we're treating a single drug agent. And it just doesn't make sense to do it that way, you know, especially when we have something like Marinol, which is THC on a less level. So again, those are many of the barriers for research that we face. And because that we're not able to perform RCTs, we're unable to have those answers for doctors to practice evidence-based medicine. So it's a circle. It goes around and around.
Yeah, it is. And so do you think that, you know, it's so complex, it's going to, you know, a total, it's descheduled and federal prohibition ends, which I just don't see happening. Realistically, I just don't see it happening for, it certainly depends on who's in the White House, depending on who's controlling Congress. So do you think that, I've heard anywhere from reschedule it to 2 or a new schedule of 5?
I would like it completely off the controlled
Yeah.
Alcohol is not any schedule. Tobacco is not on any schedule. So it has no place on there. It's a plant. Is lavender on the Controlled Substance Act? Is it scheduled to? No. And also, Jackie, once you run for office, we won't have to worry about that anymore. So.
Yes, thank you so much. My next gig.
Yep.
So let's talk about, we're talking about research. So Vireo has been and is 6, I'm looking at them right now, 6 different projects. And there are 3 of particular focus. So we've got University of Pittsburgh. We have University of Minnesota that focuses on pharmacokinetics. So I was just geeking out on pharmacokinetics and cannabis. And then Montefiore in the University Hospital for Albert Einstein with the pharmaceuticals, tobacco and alcohol. So why don't we start off with the University of Pittsburgh? And what's going on?
Do it. So we just actually started talking to Dr. Jessica Merlin and her team, and she is filling in a gap that really has been long overdue to be filled in. And that's the gap between dispensary staff knowledge and providing the best medication for patients. Because cannabis is a controlled substance, it is unable to be prescribed. It's a different lexicon that works. So it's recommended by a healthcare provider what dosage, what formulation that the patient should have. And the dispensary staff then takes the provider's recommendation and tailors it to the individual patient. The problem is that although PCCs are some of the most knowledgeable individuals I know, sometimes there is a knowledge gap when it comes to some of the physiological systems of our body, some of the different drug and drug interactions, because they didn't go through that training. At Virio, we put our patient care coordinators through rigorous training. But Dr. Merlin at the University of Pittsburgh is studying that knowledge gap, and really, which is very concerning to a lot of physicians, because they don't want to write something for their patient and they go and get something completely different. For instance, a patient that has heart problems or recent myocardial infarction should not be ingesting a high THC product because of the potential of having heart issues. So again, studying how patients in different states, how their knowledge varies, what they are knowledgeable about and what they're not. So that's really an amazing study and long overdue. So I'm really excited to have our dispensary teams in Minnesota and New York taking that survey. And I know we're going to do well.
Yeah, and how are you capturing the patient data? Are you there's some great apps that are in market or coming to market.
Sure. No, there are some great apps. I agree. I think all cannabis patients should be journaling. Yeah. The Pitt medical team has a dispensary staff survey they send out internally.
Yeah, and that was actually, I remember when Pennsylvania came to market, their medical cannabis program came to market after Maryland's, and I was particularly impressed with how they set up their program, is that there was an integration and inclusion of research and with these hospitals having access and sharing that data between the dispensaries. So I've always applauded Pennsylvania the way they set up that one. How about the next one, University of Minnesota and the
Sure. So this is a fun one. So Dr. Angela Birnbaum, who is the queen of pharmacology in Minnesota, she studied some of our products, some of our high CBD products. And what she studied is how easily the body absorbs, or how much concentration of CBD in the body is available based on diet mostly. So what she found, which is truly amazing, is that patients that consume a high-fat meal versus someone that consumes CBD on an empty stomach will have 4 times the amount of concentration of CBD on average, and sometimes up to 14 times the amount. So how amazing is that for cost reduction? again,
Right.
one of the biggest barriers that we face, you know, as people that are dispensing medication is how to make our products affordable to our patients. Research, you can have a quarter of the amount of product that you need in order to achieve the same effects if you
That's powerful. Yeah.
yes, eat a breakfast burrito, eat a cheeseburger, whatever it may be, but
Right.
you can't really cut the cost. And again, tip of the iceberg, we need so many more studies like this to really bring the best experience for our patients.
Yeah, and prior we were talking about that. I had said, oh, is there some sort of collaboration isn't the word that I'm searching for, but we're talking about that high-fat diet is often utilized in with treating seizure disorders, epilepsy. And so here you also have CBD. One of its high CBD, very beneficial to treating seizure disorders. So there seems to be maybe between the high-fat diet, this study, as well as what the pharmacokinetics. So maybe, I don't know, I'll set up a second study.
Yeah, let's do it.
And then, okay, and so then with the Montefiore study on, and the NIH is involved in this?
Yes, so we received a couple years ago a $3.8 million NIH grant, which is huge. Yeah. For opioids and cannabis. And we run that study. We see subjects in our White Plains, New York dispensary. So truly amazing with Dr. Shinazo Cunningham, who has done so much research on opiate reduction. Montefiore is in the Bronx, so it's an underserved community. So again, we're giving these patients heavily, almost free discounted products that they can try cannabis and see how it works with opiates. These are people with chronic pain, HIV patients. So they're really people that will benefit. Again, we see over and over again, people are dying every day from opiates, and there really isn't a lot of ways that we can combat it just as medical professionals, because there aren't a lot of alternatives. And chronic pain is another epidemic in our country, especially as we age. And because of the obesity issues, it's becoming very hard to manage with Western medicine. So again, having studies like this, longitudinal studies that are following these patients and really showing them benefit and improve their quality of life is such a necessity. I'm so proud to be a part of Virio because of that study specifically.
Yeah, and that underscores health equity. So right there, you're addressing the need, as you said, is making it available to folks that may not be able to afford it. Otherwise, it would be going possibly to the illicit market. And then when people say about that marijuana is a gateway drug, and particularly in these certain communities that are underserved by traditional healthcare resources, they're getting illicit cannabis that oftentimes is laced with something else, and that brings that client back to that resource and gets them onto the higher, that's where phenobarbital, or the wrong drug, the one that Michael Jackson died of.
Oh, propofol.
There we go. Yeah. So anyway, that's really powerful, that study. So, yeah. And then talking with, why is it so necessary that healthcare providers understand the complexities of the regulatory environment in the cannabis industry? It's like, we talk about regularly this catch-22 is you want the double-blind FDA approved study, but it can't be delivered because it's illegal, or it's almost impossible to have access. So share with us why it is important to the clinician that they understand regulatory.
Right, 100%. I came to the cannabis industry from a neuroscience and healthcare provider, background. And I learned very quickly early on that you need to be an advocate for the plant. You need to be a historian about the plant, and you need to be involved with legislation and policy creation they all go hand in hand. This just like the plant having 1,000 molecules, you have to wear 1,000 hats to be here. Yeah. And that's because of the fact that people are in jail right now for cannabis when people are buying more amounts in dispensaries today. So this is the war on drugs that has disproportionately affected Black and brown communities for over a century now. So this is something that always has to be spoken about hand in hand. It doesn't matter if we're saying, oh, in this population, we're able to decrease people's opiates 50%. We also have to say why this wasn't available to them when they were diagnosed with their chronic pain from the beginning. So having that conversation from the very beginning is of the utmost necessity. Patients are their own advocates, and doctors and healthcare providers are as well. They need to do the same in order to really understand why this isn't available.
Well, thank you for that. And we, prior to recording I haven't had the opportunity to see this yet. You said that a really exciting amicus brief was filed today. I haven't seen anything, so you can share some of it.
Sure. No, an amicus brief was filed today because saying that the Fifth Amendment, the Fifth Amendment was being violated. So basically, they're saying that the medication isn't available to a few patients, and those are epilepsy patients as well as a former NFL patient, but saying that the Controlled Substance Act is in violation of that. So this is really big. It's going in front of a federal judge, hopefully. But again, saying that, these are people that don't have access to medication that can potentially save their lives because of this antiquated legislation. So, I mean, this is something that I know that you're doing, and I know that so many of my colleagues are doing, but really just getting out there, being in front of legislators and saying, what's going on, guys? This is something that is so inane at this point. And a lot of people in the FDA is on board. They don't want to have this so heavily regulated either. They're fighting the fight against opiates and other epidemics that are affecting our country. So it's, most people are on the same page and saying, okay, let's get this legislation passed now so that this 5-year-old pediatric epileptic patient can have access to their medication, not have to cross state borders with an illegal substance, not have to pay so much money to get their medication, and to just be well.
Yeah, I mean, and to that is, why can't a patient in Maryland grow their own plant?
That's a great question. It's the same answer. It's, home grow is something that should be available to everybody, especially for these patients that are not ambulatory. They're not able to go out to the dispensary. Not every state is offering delivery. Some people are going to need to home grow, and who is the government to say that you can't grow your own medication?
Right. And you had made the point about tomatoes, if you'd share that analogy.
Sure. And a lot of some, different MSOs they might be saying, oh, what if I allow home grow, I'm not going to be able to sell my product anymore? Of course not. And, Virio is a long-standing proponent of having homegrown. And that's because you can grow in your farm your organic tomatoes, but that's not going to affect Safeway, manufacturing their tomatoes as well. Everybody should have access to tomatoes. Everybody should have access to cannabis.
Yeah.
You like that one? Good.
I do, yeah. And so share with, as I said, that Virio has been a supporter of Tpad, and Virio now, and you've launched this Virio's initiative in ensuring diversity and inclusion in the industry. So tell us about it.
Yes, I am one of the 3 founding members of Virio's DEI Council. I work with Jaron Forbes and Troy Bjerknes, and they're just the most amazing people throughout the country. So we've already hit the ground running. And Virio, diversity has been in Virio's backbone since the beginning, being a science and medical company. One of the initiatives that I'm working on right now is our first medical cannabis and diversity internship. We have had the most amazing applicants, and I will be working with the intern directly. And this is something that is not just a one-time thing. We're going to be doing this throughout every 3 months for now. And they will be working with me and our medical team in developing materials on different diseases that affect Black and brown communities disproportionately, and how medical cannabis can really help them. The goal is to publish so we can get this out, and to do a webinar. So I'm so excited about this. I could talk about it for hours. And everybody at Vireo is so supportive. We've had over 100 applicants with truly amazing people. It's so hard to kind of go through resumes, but I want everybody to be doing it. An event that we're doing in Maryland in a few weeks, we're hosting an expungement clinic at one of our dispensary partners, and that's something that we also want to replicate again and again as much as possible. This is something that is needed. Again, I always say it's irresponsible to talk about medical cannabis without talking about the social equity component of it. And I know Tpad is a huge proponent of this. And so
this sounds like maybe we could double team with the Tpad event.
Always. For sure, 100%. So
that's so exciting. And so what is the level of, are these college students, grad students who's
I had college students to 60-year-olds. So these are people that anybody that really has a passion for diversity in medical cannabis. And I knew I was going to get such a range of ages and different people. And I'm so happy that I did it. I've never had more fun interviewing people. And I feel like I have a newfound respect for HR. So thank you.
Yeah, it's interesting. So these, I have tried Cannabis MD. I had tried to have an intern join our team. And because of Schedule 1, I think it's, I quit about a year ago. But we're working with universities that were concerned about losing their federal funding and that they can't have a student work with a cannabis-focused company, which is just really, truly unfortunate, particularly to my alma mater, Maxwell School at Syracuse University, to be on the leading edge of public policy. But that's a conversation for yet another time. So we'll close out with stories of your rock stardom. So,
oh my gosh. I love rock and roll, and Jackie is going to be my groupie once we COVID is over. But yeah, music is a passion and cathartic. There have been a lot of studies. I just shared this study with my team about starlings who actually they communicate with themselves, amongst themselves with singing, but they also sing to themselves. And when they sing to themselves, it releases dopamine and it interacts with your cannabinoid system. So again, we know hand in hand that music and cannabis go together. And, it's another thing that I like to bring into my career, even if it's unwanted. I do.
Yeah, that's great. I mean, that again goes back to the history of Tpad, where it comes from was the introduction to the Black and brown communities in New Orleans at the home of jazz. So lots of synergy. I say there's lots of synchronicity with the folks that have the true passion for it. So, well, thank you so much. This is great. Let's see. And then you had said one last thing, that you're going to be actually an adjunct professor in my grad program.
I'm going to be giving a lecture. I'm not going to give Jackie any special treatment. But my passion is, as we spoke about, is neuropsychiatry, neurology, neuroscience, anything brain related in cannabis and mental health. So I'm so excited to be doing that as well.
Yeah, it'd be great to have you part of that. All right, well, thank you so much. So we will have lots of opportunity. I mean, there's never enough to talk about all things related with medical cannabis. So we will see you October 3rd at the Cannabis MD Cannabis Science and Therapeutics Provider Education Forum. Thank you.
Thank you, Jackie. It's going to be a great event.